Hello. Today we're going to be speaking with Dennis Hansen, Executive Director of New Beginnings Detox in Palm Beach County, Florida. The subject of our video is Suboxone Detox. Hi Dennis, how are you?
Good. Welcome. Glad you're here to listen today.
Dennis, what exactly is Suboxone treatment?
Suboxone is a treatment that is used for treating patients who are addicted to opiates. The FDA approved Suboxone, which is the brand name for the drug buprenorphine, in the year 2000. This drug is used on an outpatient basis. It is prescribed from individual practitioners. Patients come back from week to week, in some cases on a monthly basis, to be prescribed this drug. And this drug can be used for two purposes. One, for the detoxification or maintenance.
All right. Is a Suboxone addictive, Dennis?
Suboxone is addictive. It is a partial agonist. In other words, it does not have all the full range of attributes as a full agonist opiate such as heroin, morphine, or methadone. It is addictive. If you stay on this drug for a long time, you will become dependent on this drug. However, used in a brief period of time, managed properly, this drug can very gently help a patient go from a full agonist opiate, all-out dependency, and slowly detox. And in that case, the drug is very useful. However, if you do stay on this drug for a long period of time, you can become dependent.
Okay. Dennis, a lot of patients come to us from pain management clinics and have been put on very high doses of narcotic medications to control their pain. Is Suboxone effective in treating pain?
Yes, it is. It's actually a very powerful analgesic. The drug buprenorphine is used currently in the form of Buprenex, which is an injectable form. It is used in preoperative situations. It is not approved in the tablet form currently for pain. However, in Europe for 20 years, buprenorphine has been used for pain. We're a little bit behind.
What is it like coming off Suboxone?
And I might add on that previous question that Suboxone can be used to treat pain actually very effectively because it is much more stable than short-acting opiates because of the fact that it has a long half-life. Many patients that we have treated at our clinic that have had chronic pain conditions and used full agonist opiates such as oxycodone have found that Suboxone is a much easier drug to be managed on. There are not the ups and downs. Again, the long-term picture is that dependency can happen, but when you put it next to full agonist opiates, it can be very useful in a pain management situation. And the other question?
It was, what is it like coming off of Suboxone?
Suboxone in long-term usage typically is not as intense as full agonist opiate withdrawal. However, both types of drugs have two periods of withdrawal, an acute withdrawal period and a post-acute withdrawal period. Typically, buprenorphine or Suboxone does have a longer post-acute withdrawal period, and the level of intensity in those post-acute withdrawal symptoms can be more severe. However, they can be managed with the proper medications.
And what kind of medications are used in Suboxone detox?
We at New Beginnings use various different medications. There are medications to control every aspect. Again, what we are focusing on is post-acute withdrawal syndrome, or PAWS as it's called. And I will add that post-acute withdrawal syndrome is what most patients relapse on because they succumb to the temptation, the not feeling well, and the symptoms that seem to linger. The primary focus of post-acute withdrawal syndrome is to treat the patient's inability to sleep. insomnia is probably the worst symptom. And when patients don't sleep, the whole aspect or dimension of the withdrawal during the day seems to be amplified because of this lack of sleep. We use a host of different medications at New Beginnings. If one doesn't work, we try two, or we switch medications. Drugs such as Ambien, Remeron, Trazodone, these are drugs that can be used to help induce sleep. Other medications that we may use are Valium, diazepam, seems to be amazing ability to control withdrawal symptoms during the day. Obviously, a patient will have to be mildly sedated, so we have to take that into consideration. New Beginnings uses a therapy of amino acids. There are various amino acids that work to build the brain back up. Amino acids being protein building blocks that promote neurochemistry health, or neurohealth, I should say. At New Beginnings, we use amino acids from the beginning of the detox period and all the way through and well after the Suboxone has been used. We may even use some mild opiate-like substances in the initial period, medications such as tramadol, Darvocet, to actually distance the patient from the Suboxone. And then there are certain vitamin deficiencies that happen, and we seek a vitamin regimen that will replenish what has been depleted. So there's lots of tools that we have today to use at the doctor's disposal. And when you're making your choice of clinics, you want to make sure that the doctor is well versed in treating post-acute withdrawal syndrome. The last thought on post-acute withdrawal is that this is a syndrome that can last almost up to a year. And some patients have found this to be very debilitating. Some of the post-acute withdrawal symptoms that are most identifiable are insomnia, anxiety, inability to handle stress, depression. Depression is something that has to be handled with various antidepressants. That's something that we would possibly consider prescribing for patients. So this period of post-acute withdrawal is critical for the patient to get through.
All right, Dennis, in closing, what can one do to get professional help in either starting a Suboxone detox program or seeking help in coming off of Suboxone?
The federal government operates a website, SAMHSA, and if you Google SAMHSA Buprenorphine Locator, you will find a list of Suboxone patients that can prescribe in your state. If you're in South Florida, there are quite a few options. New Beginnings Recovery Center, New Beginnings Detox has a couple of clinics in Palm Beach County. We prescribe. I will say this, there are very few patients or very few doctors that know how to get patients off of Suboxone. So if you desire to come off of Suboxone, you want to ask the right questions, because you will find that everybody knows how to prescribe, but very few people know how to get you off of it. So I really thank you for listening today, and my wish is that you will find the quickest, easiest, safest, and most comfortable way to get off of Suboxone.
Thank you very much, Dennis.
You're welcome.
And again, you can find us at newbeginningsdetox.com on the web, and we wish you a great day. Thanks a lot.